Good afternoon, ladies and gentlemen. I'm George Latimer, Westchester County Executive. I'm joined here by our Deputy County Executive, Ken Jenkins, our County Attorney, John Nona. We have members of the Westchester County Board of Legislators with us, Chris Johnson and David Tubiello. We'll identify any of the others as they join us. We also have with us Joe Ricca, who's the Superintendent of the White Plains School District. And we have Ray Sanchez, who's the Superintendent of the Ossining School District. We have our Commissioner of Health, Dr. Charlita Amlin, who will be speaking as part of this press conference. We're also joined by a number of other members of our organization. Carolyn Stevens, the Chief of Staff for the Westchester County Board of Legislators, is with us, along with Jason Shavokas. We have Dr. Damian Harris-Madden, who's head of our youth bureau, who's here as well. If I missed any, I'll try to catch up on the rebound. We're here to issue a declaration, state of emergency in Westchester County. That is not particularly an unusual step. Rockland County has done the same earlier today. Other counties in the Hudson Valley, Nassau County have done the same, New York State, the United States. This declaration gives the county government, particularly the executive branch of the county government, certain powers to act quickly to deal with the spread of the COVID virus. We have had discussions with both members of the Board of Legislators, our state delegation, state assembly members, and state senators, also with municipal officials, mayors and supervisors, and also the superintendent of various schools to talk about some of the elements of the things we may have to do in this unprecedented situation. We're all very much aware that we're facing something that we've never faced before. We're going through a test the likes of which we have not experienced in our adult lifetime here in this country, and we're trying to make decisions as we go along to the best of our ability. We've seen the statistics that have been identified by Governor Cuomo. As of today, New York State has 950 cases. 221 of them are new. That is a tremendous jump in volume, but seems to be a steady percentage day after day. We've now had 7 New York residents die because of COVID-19 illness, and there's been 5 of them in New York City, 1 in Rockland, 1 in Suffolk County. Westchester County has the second largest number of cases, 220 in New York State, and we're searching a breakdown by municipality so that we can share with the various police chiefs, chief executive officers of each of the towns, villages, and cities, what those numbers are for their community. Our emergency service people, our EMS and our fire departments can respond and be aware when they respond to a location whether or not that individual or someone in that family is identified as being positive for COVID. The actions that the governor has taken were welcome. They were bold steps, many of which we were prepared to make as a county, but being made at the state is much more effective. And in harmony with New Jersey and Connecticut, New York State has announced today that they're closing all casinos, effective 8 p.m. tonight. Gyms and health clubs are closed as of 8 p.m. tonight. Theaters and bars and restaurants are closed, although there's a possibility for takeout services as part of that process. We've had discussions early in the day with members of the Board of Legislators and with our municipal officials about some of these very items which we were prepared to do, but now that they are in force, our job is to make sure that those prohibitions stay in force. All of these things that are important, local governments making an effort to decrease their workforce, waiving a variety of different fees, looking for existing facilities to adopt to medical facilities, are items and issues that we did not talk about a week ago when we discussed this. But we did say that we were going to react to events on the ground. And the events on the ground that we saw over the last 7 days is a steady increase in the infections to COVID-19. We have in the last week canceled a variety of different meetings. Events at the county center have been canceled. Visits to the county jail have been stopped from outside individuals. We have communications going to all the departments of county government to readjust workstations and readjust the way we deal with the public, as well as remind people of basic hygiene and things that will help us reduce the virus expansion. We also have, in this declaration, made a significant step that will allow us to close all Westchester public schools for a 14-day period. That's a minimum amount, starting on Wednesday of this week. The vast majority of those schools were closed already by their own decision on Monday and Tuesday. We've been working for over the last week with Superintendent Ricca, Superintendent Sanchez, and their many counterparts across the county. There are 44 separate school districts. And just to put it in perspective, when New York City makes a decision to close public schools, it is a single school district which is under the control of the mayor. And he can make that decision unilaterally. Unless we have a state of emergency, That power does not reside here in the county executive's office. So we have made this declaration in part to open the door for the closing of these schools, and that includes not only public schools, but private schools and special acting schools. And we've done these resolutions in concert with dialogue with the state education department so that we're following proper education law. The actions that we're taking is a declaration which I will sign, and then also a special emergency executive order which deals with the closing of schools. That is not necessarily the last executive order regarding emergency actions that we will take. Will be under discussion with the aforementioned individuals, both in the legislature and municipal governments, to determine what are the kind of actions we have to take in order to reduce social distancing, increase social distancing, reducing the amount of social contact, with the quest of trying to make sure that we have less spread of the virus. As you've been told before, and I know Dr. Emler will highlight this, it is the reduction of the increase in cases in any particular point in time that is essential. We know that the virus will spread. We know that it will affect a large majority of us. But if it happens all at once, our healthcare system is not prepared to deal with it. And it's in that kind of a situation that you see the tragedy and the fatalities that you've seen in other countries around the world. We also know that as Americans, we're very individualistic people. We like our personal freedoms. And almost any of us, unless you're over the age of 75 or so, do not remember a time where Americans had societal sacrifice as we did during World War I or during the Great Depression. This has now come to our generation to accept and to respond to. For whatever length of time, we would like to think that the closing of schools for 2 weeks would be enough. If that is enough, it will be. But we reserve the right to extend that in consultation with the school districts to make sure that what we're doing is not only good education policy, but it is health policy. Because at the end of the day, we're not sure what the financial impact of this is going to be. We're not sure of what the social impact is going to be. And the most important thing is the saving of human lives. And we do not put the saving of human lives on any other kind of comparable platform. We do not compare the money. We do not compare the traditions and the types of things we've done in the past. If we have to do new and different things to save human lives, that's exactly what we're going to do. I'm going to ask Dr. Charlita Amler to join us. She has done an exemplary job as our Commissioner of Public Health. She has been put almost overnight in an intense situation. She and her staff, Renee Recchia and her whole team, have really done a marvelous job. You saw some of that example last night on 60 Minutes, where some of the health nurses spoke about what their jobs were, and they made every one of us proud to be in public service. And Dr. Amler as well makes us proud to be in public service. Dr. Amler.
So anytime we are combating an infectious disease, we like to have a vaccine where we can prevent the disease, or we hope that we will have drugs that we can treat the disease with. But unfortunately, in combating COVID-19, we have neither of those. We do not have a vaccine. We do not have specific drugs yet that can be used to treat this disease. So that leaves us with one tool really in our chest, and that is that we can reduce the exposure to people, because without exposure, there is no risk. Without risk, there is no disease. So that is why closing schools, closing restaurants, preventing people from congregating together, that is the goal of that, is to reduce exposure, prevent exposure, and thereby reduce people from getting sick. So as the county executive was saying, with most infectious diseases, as they occur, you have a spike in the number of cases, because all of those people who've been exposed, who are susceptible to the disease, develop the disease. And if we get huge numbers of people, that is our concern, who are ill, our hospital systems may just not be able to deal with that large a number of people. So it is our hope that by reducing exposure, we can flatten that curve, keep that peak from occurring, keep the numbers lower, and by doing that, we'll buy time for us to develop a vaccine, to get drugs that we can treat it with, and hopefully we will prevent people from dying. So I appreciate the governor's and the county executive's efforts to reduce the exposure for our entire population, especially those most vulnerable, our seniors and people with immunocompromising diseases who are at greatest risk of death from this virus.
The county has embarked on a number of different activities that are critical in this direction as we look to the future. We are identifying right now through Joan McDonald, who is with us, our Director of Operations, a number of different sites, whether they're county-owned or privately owned, that may serve some purpose as we fight this contagion. We are looking at vacated spaces like Arrowwood, former conference center that closed a few months ago. We're looking at sites that have long been closed, like United Hospital. We're looking at office buildings in a variety of different places, College of New Rochelle, which has been transacted in a sale. In each one of these cases, we're talking to the ownership, and we're trying to determine what possible use those facilities might be. They might be used for medical backup purposes. They might be used to house individuals who have to go through isolation because they've tested positive for COVID-19, but they live in a setting, in a multifamily building with a number of other people for which the traditional quarantining won't work quite the same way and effectively. We're looking at a host of those different things, and we're trying to be helpful in this and look forward. We're prepared to allocate county resources toward that end. Glen Island parking lot has become the site of our first mobile testing facility where we've jumped up the testing dramatically. The state is in charge of that, and over the course of Friday to today, we've had many more people tested than could be handled in the one-on-one testing that happened previously. And we certainly have other places that are available, Playland, FDR Park in the northern part of the county, should the state determine to open a second or a third site in Westchester. They obviously have a statewide issue to deal with, and so their actions will take in Long Island and upstate and New York City as well as Westchester County. We also want to highlight that we are working right now on a plan to reduce the amount of our workforce that comes into this building and the other county-owned facilities. There are some departments that lend themselves to working at home. Some departments, whether it's law, budget, finance, information technology, planning, it is possible for some of those people to work at home, work productively, but do that without having to come into this building or the place of work. There are some departments for which that's not feasible. We operate a county jail. We operate a sewer treatment plant system. We have a probation department. All of those things require in-person action in order for the service to be delivered. But we are looking at ways to reduce the workforce, reduce their risk in the marketplace as individual employees. We think we owe that to our employees, and we've been communicating that to them in a moment. Now, the two things I'm going to sign in a second, one is a declaration of the state of emergency. The other is the first executive order, which deals with the closing of the public schools. The decision to do that has come out of a consensus, and I want to thank both Joe Ricca, Ray Sanchez, who are here, and many other superintendents for helping dialogue through this. A week ago, in first conversation, not every school district thought this was the right idea. As things have evolved, we've reached this point. But before I have Ray speak, I want you to understand that we are also taking care of two issues that we think are very important. The first one is making sure that young people who are needy and get their nutritious lunch through the school system will be able to continue to have that nutritious lunch provided to them. And also that those individuals who have child care issues when their children are normally at school, this would primarily be the elementary school children, the school lunch matter goes through them, K to 12. But for those who require some kind of child care during the course of the day, we're working now to try to find sufficient child care for all of those parents who may need that. Not all do, but for those that do, to make sure that their children allow them to be properly cared for so that they can work in some of the most critical fields of endeavor, in the healthcare industry, in hospitals and nursing homes, or in in-home visits. Those individuals who work in law enforcement, emergency services, and fire, all of those parents have to be free to do their important work, and they also have to have their children watched. So in the closing of schools, we were mindful of both of these things. Ray Sanchez, who is the superintendent of the Ossining School District, has been a tremendous partner for us in helping us understand and shape this, and I'd like Ray to say a few words.
Okay, well, good afternoon, everybody. And at first, I want to thank the county executive and his team. I have to say, very honestly, and I know I speak on behalf of all the superintendents, they've been outstanding as a resource to us, working collaboratively as this situation continues to evolve, thinking about the needs of our children and our community and their safety. And so I want to thank them, and I know that as we proceed, today's plan is just that, today's plan. I know that it'll continue to evolve, and I know we'll continue to work together. I'd be remiss, too, if I didn't give thanks to all our educators, our superintendents, our administrators, our teachers, our clerical staff, buildings and grounds, our entire teams at each of our schools who are working hand in hand to make sure that education continues for our children while being different, we want to make sure that we continue to provide the types of education that we can, considering the difficult situation we're in, and at the same time remain safe during this period of time. I also want to thank my colleague Joe Ricca, who's been working alongside the county executive to really make sure that we reach this point. I think this is a really important decision that's being made in terms of closing school. It doesn't come lightly, but we know it's the right decision on behalf of the safety of our students. Again, the times continue to change, and we anticipate continue to work with the county executive and throughout the region to make sure that our plans are aligned and that we support the needs of our children. We are working together now to figure out and determine how we provide the necessary child care for various individuals and employees throughout the county so that they too can provide valuable services throughout our region. With that too, I'd be remiss too if I didn't take a moment to speak to our children. While they're at home, I want them to know a few things, and I know I speak on behalf of everyone, our educators, our superintendents. When I say this to our children is, number one, we love you, we care for you, and we're going to be there for you all throughout this process. And we look forward to the day that we can open our schools and invite them back so that we can provide the great education that I know takes place throughout Westchester County. And so just make sure you know that we're always going to be there for you no matter what. Thank you very much, and I want to again thank the county executive for your support.
Thank you. I want to recognize a young woman who's with us here. I just wanted to step forward a little bit so that she can get proper appreciation. We talk a lot about what it is to be a public employee. Those of us in elective office are too much the face of the public employee. But many times a public employee works behind the scenes of visibility, but the work they do is incredible. Jessica Brown, who is here, is a Westchester County public health nurse. And more than any elected official, more than I am, she is an example of the heroic spirit of this county. Jessica has 2 children of her own in the Austin School District, and obviously she wants to care for them properly while they're in school and when they're not in school. But at the same time, she's committed by her career and profession to help other people, help them through difficult situations. If you saw last night on television on the 60 Minutes show, you saw 3 young women who were all healthcare nurses and how they had to put on the special PPE. It makes them look like spacemen. And it's very foreboding for those of us who are civilians to watch you when you're dressed that way, understanding that what you're dealing with is so potentially dangerous that you can't come in contact with it even as you try to help people. But Jessica, we want to say thank you. Thank you for your service. Thank you for the service of all of your colleagues that do this. We deeply appreciate it, and we owe you a round of applause.
Can we ask Jessica some questions?
We will in a second. As soon as we finish this, then we're going to open it up and you can talk to any of the folks who are here. I'm going to ask John Nona to please give me the documents that we need to sign to effectuate this. I'll make some closing comments. We'll open up to general questions and then individual. This is County of Westchester Local State of Emergency Declaration, and it's dated today, March 16th, 2020. And this declared that all required and available assistance be rendered to address this public health threat, that a local state of emergency exists for Westchester County for a period beginning on this day and shall remain in effect for 30 days or until rescinded by subsequent order or is extended. And the local emergency order number 1 for this is pursuant to the declaration of emergency, and this is the particular declaration that closes all public and private schools in Westchester County, except for staff that's performing a particular function as determined by each school district. This also covers non-public schools and special act district schools within some parameters created by the State Education Department. Do you have an actual time for right this moment?
3:22 p.m.
3:22 p.m. And this executive order is now in force. This means that Westchester County schools will be closed as of Wednesday. Will remain closed for 2 weeks until the 2 weeks following Tuesday. But we will be discussing with the boards of the school boards and the various superintendents, and we may very well extend that order further. We will try to be consistent with the other counties around us. Let me make one more comment, then we'll open it up to questions. We understand that this is a great situation that we face. Nobody has a roadmap on how we proceed. When I talk with members of the legislature here or our state colleagues, when I talk to professionals, Dr. Amler and other healthcare professionals, there's no singular roadmap as to what we do next and how we improve and how we move forward on this. One thing I can say is that I have had the good fortune to have descended from a grandfather who fought in World War I. He mustered to France as a very young man, 17-year-old boy, was a doughboy in his era, in the era of my father, the era of the Depression, and World War II, which both my mother and father had to survive. I heard stories from them both about my grandparents and about their life during both the Depression and during World War II. And as I heard those stories as a young boy, I really didn't appreciate how much of a difficulty was in the society, that they rationed items, that there was a war going on, and they didn't know the end of the war. From the day I was born, I knew that we had won the war successfully, but they did not know that while it was going on. There was a lot of insecurity and a lot of fear as to what would happen as that played out. But I thought to myself that my grandfather faced his test and he passed it, and his generation passed it. And my father and my mother and their generation faced a test. They passed that test. This is now the test that we face in our generation, all of us. Some of us are a lot younger than I am, some are older. But the way we face up to this test will determine whether I am my grandfather's grandson or my father's son. And whether or not that I and everybody else of this generation has the strength of purpose and the will, the ability to stay focused, the ability to take something seriously but not become frantic, to be able to play this and understand this and make the adjustments to our lives in order for us to be as successful in this crisis as they were, and frankly, as every American has been in every crisis we faced. But we face another crisis, and now we have to draw on a common spirit of unity. And that unity crosses all kinds of boundaries, political boundaries, demographic boundaries, gender, race, religion. Those things don't matter anymore. This virus doesn't discriminate. It can get into any one of us. It could, in theory, take our lives. And if that is a battle against the whole human race, then it takes all of us together to do the things necessary to try to fight. With that, I'll open it up to questions to myself or anybody else. Yes?
Can you just reiterate the status currently of Westchester County's bars, restaurants, movie theaters, any social areas? I've seen doors open to restaurants. What is the current status? Because I think people don't know.
The governor today issued a statewide executive order that applies all across New York State, so Westchester as well. And my understanding is that he did that in concert with the governors of New Jersey and Connecticut. So my understanding is this is now a standard across the board policy. Restaurants and bars will be open until 8 o'clock tonight. From that point forward, the only opening available use of restaurants will be for takeout orders or delivery orders. And that will be from tomorrow onward. I don't know if there was a termination date of his executive order, but we treat it as a minimum of the next 2 weeks, if not a longer period of time. So we will not be able to go into a standard restaurant or bar beginning 8 o'clock tonight. We will be able to order food, have it delivered, and so forth. Gyms and health clubs and theaters are also under the same order. And theaters mean motion picture theaters, movie theaters in our communities, not just the Broadway theater. That they will be closed as of 8 o'clock tonight and will not reopen until the governor rescinds his order as a means of trying to reduce the community spread of the disease.
You mentioned providing
Tony, and then we'll go this way.
I could ask the health commissioner, as you look at the numbers and the daily new case volume, 12, 16, 10, 13, 27, 10, 20, 18, 24. Is that manageable? Are you pleased when you look at these numbers? If it doesn't quite rise to the level of pleased, you find them interesting? Are you optimistic? How should we're not seeing dramatic, huge gains in new case volume every day.
Well, and that's exactly what we want to see. I mean, obviously, I'd love to see 0 cases, but we want to try to contain this. And I think we do that by all the measures that have been put in place. And we have to continue to have people take this seriously. And I mean, when the schools close, that doesn't mean kids should be out congregating with each other. It means that we're asking people not to congregate. And so it's up to parents to ensure that, that their children are safe, that there's someplace where they're safe and they're not potentially at risk of exposure. And if we do these things, we can keep the numbers low. If we don't do these things, we can see these numbers dramatically rise, which is exactly what we're trying to prevent.
How do you characterize the numbers that we're seeing?
I'm alarmed by one case. I don't want to see any cases. And to say that, am I surprised? No. But I think it's all in what we do going forward that counts. And that's what we need to work on.
Attorney, let me add on that before we go to the next question. Part of the numbers that we see are a function of how much testing is going on in a different area. Westchester had the first mobile testing facility, and so I'm not surprised that we have 220 cases, which is a higher percentage than you see in counties like Nassau and Suffolk that have greater populations than we do. I think as testing becomes more universal, you'll see everybody's numbers go up, and what will probably happen is ours rises. Some of the areas that have somewhat similar populations will see theirs jump more dramatically. But at this stage of the game, the number and the statistic I'm most interested in, the governor shared a statewide statistic, we do not have a Westchester comparable, that said 17% of all the cases have now wound up hospitalized. And if you've heard the statistics earlier on, those who follow this, you've said often about 80% of the people will get the disease and be able to fight it off with their natural antibodies, and 20% of the people will get sick. And of that 20%, those that get more seriously sick will be in life-threatening conditions. When I hear that we have 70% hospitalized, I'm thinking to myself, we're falling into that range. The percentages are one thing, but the absolute number of people is what the concern is now. Because if you do get to the point of 20% of 220 people being hospitalized, we're talking about roughly 40 people or so being hospitalized, and then we start to worry about the capacity of the healthcare system to deal with it every time we jump up. So at this stage of the game, we've tracked where Italy was at the same period of time of contagion. Those projected numbers are not comforting. If we follow that path, we're going to be in a very serious situation pretty soon. Yes, Peter?
Closing schools means that vendors who deal with schools won't be able to, they won't have the business coming in. Closing restaurants and bars and theaters means they won't have money coming in. Businesses are going to lose their cash flow, face some jeopardy. Even the county will be losing sales tax revenue. What have you looked at in terms of the financial impacts, and can the county do anything to help these businesses?
Right now, Peter, until the contagion is controlled and reversed, we are in a free-fall situation within the society economically. It's foolish to talk about how we would stabilize our economic structure when we haven't figured out how deeply this is going to cut. And so the closing of businesses today that the governor's made, and I supported that decision, was not made a week ago as we tried to resist it. We even made efforts, Ken and I went out to show that you go out and have lunch and try to boost a little bit of that. But now the numbers make us past that point. And I don't think, sad to say, that the economics are going to drive the decision making. When this contagion is over, when it has run its course, when we see just how successful we are or are not, we're going to have a large economic hole to dig out. And it's not just the Westchester hole, it's not just the businesses that I visit and patronize, it's going to be all over the United States of America. And that will put us in a very tough economic situation, and then it will be at the federal government level to help us through this, because no state, as powerful as New York is, has the resources to pull us out of a recession, nor does the county government, nor do the local governments, nor does any one business. The largest corporation in America is not going to be able to single-handedly to pull this out. It will take a response from the federal government. We'll wait to see how that plays out. But what I hope is that we'll see a greater appreciation of Washington, D.C., because let me tell you, we understand it in Albany, in White Plains, and in town halls and city halls. We understand what this means, and we know that we have to take action. We're going to need their action to deal with the economic impact that you're rightly seeing happen to us. It's going to get worse before it gets better. Yes, ma'am.
You mentioned providing lunches for school children and perhaps childcare for adults of the school children. How would that look? Do you have any information on when?
Well, let me ask either Joe or Ray if they're comfortable explaining how they plan to handle school lunches in their district with the closure of the district. Either of you feel comfortable handling that?
So very soon, we're going to be providing lunch. We're going to basically have staggered schedules in various buildings so that we don't have large numbers of students and families entering the buildings. We're also working with our food pantries to make sure that we can distribute food to families during this period of time within our communities. The question around childcare, that's one that we're continuing to work with. We're working with the county executive, with his team, and each of us. That plan will continue to evolve, but we hope to have that very soon.
Before we go to the next question, let me amplify on the child care. I mentioned Joan McDonald. I introduced her a second ago. I know she's still with us. She is working on a plan that has to be submitted to the state by this evening on the child care piece. The school districts are normally structured to provide lunches, so they have to make some adjustments. They're not normally tasked with child care. That's why the county has to take an extra step to make that happen.
But will it be
Yes,
within
ma'am.
the districts, or will it be some sort of more centralized?
Well, what we're looking at is, first of all, what's the demand for childcare in area by area? The smaller the district, the wealthier the community, the less likely that much of that is needed. You might have a parent home that can handle their children, so the demand is small. The larger the district, the more urban the district, the more poor the district, the more that has to be put into place. So it won't be one singular place that everybody drops their kid off. That's not really practical, to say open the county center and have people come from all over the county. But that's what we try to work on now, and more likely than not, rather than every district or one central place, most likely they'll be regionalized. There'll be a regionalized place that a couple of districts can feed into. That's the expectation. But what we will do is when the plan is completed, we'll submit it to the press. Catherine will make sure you get a copy of it. If you have any questions about it, you're certainly welcome to call us and follow up. Yes, we can follow
The
up.
educators can talk more about social distancing. I live in Westchester. I've seen it with my own eyes. Play dates are still happening. Teenagers are driving around together in cars. Can you have a message maybe to parents on how important this is? This is happening.
I think that's exactly why we're here. We're here to tell people that you really do need to take this seriously. I mean, when's the last time in your lifetime that all restaurants were told to close, that you couldn't go to the movies, you couldn't go to the gym, the schools are closed? If that doesn't wake people up and say, hey, this is a problem, you really need to be paying attention, then they're just not listening. But the fact of the matter is, as I said before, the only tool we have to stop this disease is to prevent exposure. And if you love your children and you want to take care of your children, then you should keep them a safe distance away from other people right now at home. Give them activities to do, keep them entertained at home. But large groups of people are just not a good idea right this moment. It's as simple as that.
And I know that they don't necessarily listen because of my age. And let me speak directly to the 16, the 18, the 22-year-olds. Whether they believe it or not, we were all that age at one point in time in our lives. We know exactly how important the social interactions are. Colleges have let their students go back home. They're back home and they can't wait to congregate at the local spots. Your life is at risk. When you're 22, you believe you're indestructible and you'll live forever. And you might very well live a very long period of time. But this disease can affect a young person, and under certain circumstances can take a young person's life. Or they could carry the disease back home, and they could impact their grandfather or their grandmother, or perhaps their parents. And this is a moment where the natural desire to do whatever you want to do, in the wonderful freedom that America gives us, has to be leavened by a practical reality. And sometimes it's not just, I tell you what you ought to do. I tell you what you need to do. I grew up in a household, a little bit different era, in which my father put the law down and that was the law. And I think sometimes now that's what we need. In the same way that we have to discipline ourselves to do things differently than we would prefer to do. We don't like the restrictions on our life. Who doesn't want to go out after work and have a drink with colleagues, But just to do your job, to come out into the public, to interview us, you put yourself at some risk. When you interview somebody to get that story just the way you want it, you put yourself at risk. And we can't afford to have that happen. So for any young people that are listening, they may listen and read some of your publications. Hopefully they do. This is not joking around. We're serious. Yes, sir.
Do you have any update on the 89-year-old woman from Scarsdale who died yesterday who had been tested the day before?
We don't know if she is tested positive for coronavirus. She may have had it, she may not have, and if she did have it, it may not be the coroner's cause of death. We'll have to wait to see the final word on it. There's no joy in finding out if she was or wasn't with coronavirus. We lost a human life. We lost a neighbor in this county. But this is the major problem we're dealing with in the early stages of coronavirus, which is for people who have underlying health conditions, and Dr. Andrews said this a number of times, that their state is weakened, and then this virus can be the final blow that kills them. They might actually die of a heart attack. They might actually die of some other failure. But the coronavirus becomes this last bit of tragedy that ends to the final death. I think we're all concerned that we get too oriented to statistics. It's human nature, to look at how many deaths do we have and so forth. It is the amount of life that we're trying to protect. And when we lose somebody, that's tragic, but it's how many people can we protect from getting to that point. And that's why the number of beds we create, the number of ventilators that we have available to help people breathe if they do reach that level of illness, those are the really important statistics, so that we save lives and not just look at those who died. But we don't know the information. We may know that today or tomorrow. If that's important for you, feel free to reach out to Catherine. As soon as we know it is publicly disseminated, we'll be happy to share it. Any other questions as a group?
Thank you.
Yes, we're gonna loosen everybody up so you can talk to them. And if there's no other questions, thank you for your time. Feel free to talk to Jessica. Feel free to talk to Dr. Ambler, Ray, Joe, this camera guy.